Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for returning. In this segment, we're going to be speaking with Dr. Charlene Gamaldo. She's joining us here as the medical director of the Johns Hopkins Center for Sleep at Howard County General Hospital and professor of neurology, Johns Hopkins University. She's going to discuss the daytime impact of insomnia and some of the key findings from the Wake Up America survey conducted by the Alliance for Sleep and Idorsia Pharmaceuticals. Welcome to Health Professional Radio, Dr. Gamaldo. Thank you for joining us here.
Thank you for having me.
Well, I did, of course, mention your role there at Johns Hopkins. Give us a brief look into who Dr. Gamaldo is.
Sure. So I have been practicing sleep medicine for over 20 years. And as mentioned, I am a professor of neurology as well as secondary appointments in anesthesia, critical care, psychiatry, and public health. So as you can imagine, many of those sort of bridge sleep as a, pillar of health.
Now, I mentioned the Wake Up America survey that was conducted by the Alliance for Sleep and Idorsia Pharmaceuticals. What is the Alliance for Sleep? What's its mission?
Yeah, so the Alliance of Sleep is a group that I'm really proud to be a part of. It's a consortium and collection of multidisciplinary sleep experts in the fields of sleep research, sleep clinical care, and sleep education. And the mission that we were charged with was to gain more insight into insomnia, into the impact it's having on folks in terms of their daytime functioning, and also to get a glimpse into where some of the members of our healthcare community who are not sleep experts, but often the healthcare providers who are on the first line for addressing sleep issues within their patient population, to get an understanding of where their needs are. So this survey actually was the largest of its kind, where it polled 1,000 adults. It also polled 300 general practitioners and 150 psychiatrists. And that was something that really, I'll tell you, opened my eyes, excuse the pun, to some of the things that I didn't realize were going on within our patient population and for our healthcare providers.
Give us a cross-section of those 1,000 survey participants where there's wide variety of ages, men, women. Behind that question, is insomnia something that can affect anyone at any time?
Correct. So what I really appreciated about the study is that it was a very nice representative sample of adults 18 years and up, representing the various age brackets. It was also had a diversity of participants in terms of ethnic and racial diversity, as well as other elements that are critical to folks' sleep experience, in terms of, where they lived, in terms of whether in the suburbs, urban environment, et cetera. So it's really important to get a very diverse population to kind of understand all of the various layers and textures to what makes a good sleep experience. So that's what I really appreciated about this survey. And again, it was the largest of its kind. But the other thing that was really important with the survey is that, as sleep experts, we are in our, very specified lane, expert lane. But the majority and lion's share of patients who have sleep issues don't come to us first. They typically, if they are going to seek medical care, it's going to be to a general practitioner or in some cases a psychiatrist. So that's why it was really important with the survey for us to understand what was going on for our frontline members of our frontline team, so that we can help bridge the gap.
Now, before we get into some of the key findings of the survey, why is sleep quality so important? What are we talking about when we're talking about the daytime impact of insomnia? Is insomnia something that includes anything and everything that causes a person not to sleep or to have trouble sleeping?
So, Neil, I'm so glad you brought this up because this is the very important nuance that I hope your listeners can take away. That there is a big difference between insomnia as a symptom and insomnia as a diagnosis. So let me unpack that. So insomnia as a symptom is, at night you may have problems falling asleep, staying asleep, or you didn't wake up feeling restored. If that happens every now and again, that's an insomnia symptom, and that's natural. That will happen to any of us. That's not a problem. It's just, how things go sometimes. It becomes a medical condition with this specific criteria, and it's the rule of threes. All you have to remember is this, that if an individual has problems with initiating sleep, maintaining sleep, or not waking up feeling rested or restored, and it's occurring over 3 times a week for over 3 months, and it's associated with impact in their daytime functioning, then it's a medical condition. It fits the diagnostic criteria that's worth discussing with your healthcare provider, because once it gets to that level, it does impact not just how the person feels, not just their overall wellness, but their overall, medical health. So we know it's associated with, multitudes of medical conditions. As a neurologist, we know it impacts cognition. It potentially impacts, cognition down the road, but also things like heart health, metabolic health, risk for diabetes. The list just goes on and on. So you owe it to yourself in terms of how you feel the next day, but also how your overall health is long term, to discuss it with a healthcare provider.
Well, go into some of the key findings, some of the major takeaways from this survey. Did anything surprise you?
Quite a few things blew me away, and I think the aspects that blew me away were the fact that we always knew that part of the diagnostic criteria was that the patient had to endorse that their problems with sleep were impacting their function during the day. But what I had a greater appreciation because of this survey was the magnitude of that impact. I really did not appreciate. And what I mean is this. 70% of the folks who endorsed having insomnia said that they were desperate for more education and desperate for options to improve their sleep quality. And they're spending a lot of money to do that. It's like $7.1 billion a year is spent on sleep products. And that it amounts to about $300 a year per person. But, Neil, what really, blew me away was, again, the impact in terms of folks. 19% said that they lost a relationship because they believe it was due to their poor sleep, impacted their ability to maintain that relationship. And a little less than a third said that their financial struggles, they specifically link it to issues with their sleep. So from that degree of impact on folks' quality of life, their social, health, I did not appreciate to this degree until the results of the survey.
What advice do you give to someone who's struggling with sleep?
My advice is to, rewind this interview and do the checklist of the rule of three. And if you check all 3 of those boxes, please, please, please know that you're not alone. Please, you owe it to yourself and to your long-term health to discuss it with your healthcare provider. And that's the work of the Alliance group, is to provide greater awareness, not just for the patients, but also resources for our members of our frontline healthcare team so that we can hopefully close this gap.
Well, give us a website where our listeners can learn more.
Absolutely. So wakeupamericasurvey.com is where you can learn more about the survey, learn more about the Alliance, and learn more about just sleep education in general.
And that's spelled exactly how it sounds, Wake Up America Survey, all one word, .com, correct?
Correct.
Charlene, I appreciate your time. Thank you so much for joining us here on Health Professional Radio.
Oh, thanks for having me, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Charlene Gamaldo. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.